the osteoclastic activity and they decrease the osteoblastic activity. Therefore, the balance between the two is lost in favor of resorption. So there is more bone loss, and also because of increasing weight, there is more load on the weight-bearing joints. And therefore, there is a thinning of the cartilage at the joint level. Also, there is sarcopenia, as was discussed by the previous speaker. So the support given to the joint by the muscles is also lost. And because of all these factors working together, the joint is hampered. So, it's not moving. So, reproductive aging actually is a systemic inflammatory transition with far-reaching musculoskeletal consequences, as we have been witnessing since morning. As we all know, there are multiple regions in the body that are affected, right from the brain to the toe, the pins and needle sensations, the genitourinary problems, the vasomotor problems, the cardiovascular risk. But of course, the day-to-day activity actually is run by our limbs, and the joints are badly affected due to menopause. And here, because of inflammation, all the 5 cardinal signs, that is, there is warmth in the joint, there is redness, there is swelling, there is pain, and lastly, there is loss of function. So how does estrogen deficiency actually work? As I mentioned previously, the cytokinins and the TNF alpha factor and interleukins, there is an interplay of all these. There are receptors on the osteocytes, osteoblast, and the osteoclast. And when there is estrogen there, so there is a protective role on the osteocytes. There is less apoptosis, and therefore bone remodeling is actually governed to a certain level. But when the estrogen effect is lost, the osteoclastic activity increases, because all these cytokinins actually are mediated through the T cells, and they bind to the receptors and they make covalent bonds. And because of that, there is this rank L induced differentiation of the osteoclast. There is more of osteoclastic activity, so the bone actually is getting less formed and more is getting destructed. This IL-7 upregulates the T cell derived cytokinin rank L, which promotes osteoclastogenesis. And TN-alpha actually stimulates sclerostin, which is a glycoprotein which inhibits the bone formation. तो एक तरफ तो bone form नहीं हो रही है और दूसरी तरफ जो बन गई है वो टूट रही है. So कुल मिला के the joint has to bear the consequences. One more factor comes into play, which is the oxidative stress. Here, I would like to mention the effect of ROS, that is the reactive oxygen species, which decreases the bone mass. And here the role of Tai Chi, yoga, and impact exercises comes into play. There is chondrocyte dysfunction. There is increase in metalloproteinases. These are enzymes which cause synovial inflammation and subchondral bone remodeling. There is more cartilage degeneration. And of course, in the elderly, pain amplification is there, and therefore the function also declines. Now, there's one factor that I would like to bring to the notice of the house, that arthralgia is many a times confused with arthritis. There's a difference. Arthralgia does not have any inflammatory signs. Those 5 cardinal signs of inflammation are absent. There is only joint pain and there is stiffness. So here is how we can differentiate between the two. Of course, osteoarthritis starts with arthralgia and later on gets converted into osteoarthritis. One more differential diagnosis we have to keep in mind is the rheumatoid arthritis. Change हो गया सब. Rheumatoid arthritis has an immunology. इसमें change हो गया वहाँ पे. यहाँ पे देखिए. देखिए. So the rheumatoid arthritis has a immunitis. What happens in rheumatoid arthritis is slightly different. That because of inflammatory agents, there is more of synovial fluid collection. So there is a swollen joint, there is a painful joint, there is redness, and this is a picture inside. this we have discussed. Inflammatory signs are there in rheumatoid, and they are in arthritis. There are inflammatory signs. Now, the difference between rheumatoid and osteoarthritis, because of the immunological response, it sometimes flares up and sometimes it eases. But osteoarthritis gradually progresses. There is no ease. Once it has started, it will never go. It will go, of course, with medicines. It will decrease with medicines, but it will not go altogether. There is an associated fever, fatigue, and rash associated with rheumatoid arthritis, which is never seen with osteoarthritis. There is a popping or joint pain. There is a clicking sound which comes on movement of the joint. This is classical of osteoarthritis. You can't see it in rheumatoid arthritis. And treatment, of course, differs. The disease-modifying anti-rheumatic agents and steroids are used to treat rheumatoid arthritis, whereas for osteoarthritis, we have pain medication, which works. So, we can see that the natural aging process deprives of a very essential factor, that is the estrogen. The hormonal fluctuations, in turn, lead to multiple changes in the body. One of them is in the joints and in the bones, then genetic factors. As my previous speaker mentioned, that if a person has a late menarche and early menopause, they are more susceptible to arthritic changes. More changes in the bones and more changes in the joints. If there has been an early menopause due to some chemotherapy, the patient is suffering from cancer, radiation therapy, or surgery has been done, oophorectomy or something like that. So there is a premature ovarian failure. In that, cessation of menstruation becomes earlier. In that case, there are more chances of that case developing into osteoarthritis. Now, the lifestyle, of course, plays a very big role. Smoking and alcohol, as we all know, have a detrimental effect on joints. So, how do we manage it? Exercise. Low-impact activities like swimming, yoga, cycling, they build the supporting muscles and improve flexibility. Diet, which contains anti-inflammatory agents like omega-3 compounds, like we can get fishes, deep sea fishes we can get, and if you are a vegetarian, then avocado is a good source of omega-3. Calcium and vitamin-rich food, then weight management, as has been discussed since morning. Pain relief, of course, NSAIDs we are using. Acupressure, physiotherapy, and acupuncture also have some role. HRT has been discussed at length in another section, so I do not repeat that. And lifestyle changes, of course, have a positive role. These are the exercises where we have weight or strength training. We lift our own body weight with that. We don't need any special equipment other than an elastic band, which is called a TheraBand. With that, we can do some stretching exercises. Cycling is a simple exercise. Swimming is a very good exercise. The only thing is that we should not do very jerky movements and very robust exercises. They have to be low-impact exercises which need to be done. Tai Chi is something like our yoga. It's actually meditation in motion. They make certain poses. Actually, it's a martial art combined with the meditation. It actually says Chinese people believe that by doing Tai Chi, they are connecting with God. The way we connect ourselves during meditation, they say that the strength of the soul increases with Tai Chi. There are nice flowing movements. They feel the movement of air. They make certain poses, which are martial poses. And these simple poses that they make actually increase their flexibility, increase their balance, increase their muscle power. And because there is a meditation element added to that, so there is some reduction of stress. And when stress is reduced, there is ROS decrease, which again is a pro-inflammatory agent. If it is suppressed, in that case, the joint will not be disturbed. Diets will be discussed in details later on, but the basics are here. If we take whole grain, we take fruits and vegetables, we take milk products, we take tofu, and we take avocado, broccoli, etc., they are good for us. Vitamin D has been discussed. B complex members, B6 and B12 and folates are essential. E actually has multiple roles, right from your skin and everything, even in the joints it has a role. Calcium and magnesium. Magnesium I would especially like to mention because there are mood changes and there is sleep disturbance in the menopausal women. That actually is corrected by magnesium if it is added with calcium. Omega-3, everybody knows that it has a very nice cardiovascular effect and also an anti-inflammatory action. Then alternative therapies. Since age-old times, we have been using our Dadi Ma ka nuska of turmeric and ginger. हल्दी का दूध पीना है, हड्डी में कुछ भी प्रॉब्लम हो रहा है तो that हल्दी का दूध actually has a potential action. It has anti-inflammatory role, it has immunological role. Multiple things have been seen in curcumin, which is there in turmeric. And in ginger also, there are multiple factors which actually help the joint. Then glucosamine and chondroitin are actually constituents of the cartilage. And because the cartilage is being eroded with age, so therefore, if you want your joint to be very good, then you have to take chondroitin and glucosamine supplements. Ginger actually has gingerols, schwaggols, and gingeron. These are the active agents inside it which have got anti-inflammatory property. Turmeric, we know, is a very nutrient-rich spice, rampantly available in everybody's kitchen, being used day in and day out. It has an anti-inflammatory role, antioxidant properties, and immune-boosting properties. So it takes care of arthritis and also some other factors that are associated with menopause, like depression and sleep disturbance. Can HRT help in osteoarthritis? Yes, but we have to actually balance the risk and benefits. So we actually need to assess, take a detailed history, take the history of a family history of cancer. Is the patient a cancer survivor? Is the patient on HRT, or has she taken any treatment regarding this? So once you assess everything, then and then only should you give HRT. Otherwise, that is the last result. Thank you.